Thank you for joining. Hello, Dr. Denny. How are you doing tonight?
Hello, Stephen, Dr. Jenny Show.
Yes, ma'am. Doctor, ma'am. Yes.
Dr. Man, that's Mrs. Do to you.
There you go. Well, welcome everybody. So I want to just thank everybody for taking time to come and join us this evening. If you happen to be watching on Facebook or you're watching on YouTube, we want you to share this out to your friends in the groups you belong to. Of course, you can watch this on E360 TV on the platform, and that's on your Roku smart TV or your Amazon Fire, Apple or Android TV. We're on TV. If you got one, download that app, watch us there. So we appreciate everybody that's taking time to come and join us tonight. It's going to be a great show. We want you to stick with us because if you leave, you just might miss something that's super important. Yes, this is for the women as well, most specifically, but we're going to be talking a little bit about stuff for the men too. I wanted to start by just telling you a little bit. I've got some information here about cancer in general. Okay.
Mhm.
And actually, cervical cancer is what the focus of tonight's show is going to be on. We're going to be talking about women's reproductive system and the five types of cancers that are involved with cervical cancer. There's actually in 2020 going to be about 13,800 cases. This is according to the American Cancer Society. Uh, New cases, 13,800. And about 4,290 women will die because
Mhm.
of that. So that's not good. We're going to be
Nope.
talking about how we can maybe prevent cancer. We're going to be talking about the steps that you can take to get healthy to try and prevent any type of chronic disease. You know, between 2010 and 2020, new cases are going to be going up about 24% with cancer for men. Something to consider. It's time to get healthy. And women, about 21%. And we're talking about a million cases in that 10-year
Mhm.
period of time. So that's why we're talking about this tonight because we want to educate you. This is an interactive broadcast. If you've got comments, you've got questions, put them in the comments. If you're watching on Facebook, we'll be happy to address those comments and questions. So you're doing pretty good. You're pretty happy today, Dr. Jenny.
I'm always happy.
I love
you
your
can't
spirit.
you
You
can't
are.
get a girl like me down. Doesn't matter. Sticks and stones will break my bones, but words don't ever hurt me, right? Isn't that what the say?
Exactly.
Right, because negativity causes cancer. I don't want to get cancer. And
I don't want it.
some people are not worth getting cancer for. I actually posted something about toxic relationships because we kind of have a theme going, right?
Yes.
Toxicity, negativity. Every single week we're talking about how to reduce our stressors, right?
Yes.
And because we're reducing our stressors to prevent disease, because being stressed out is not good for your health, whether it's stressors from your environment, stressors from a loved one, stressors from a friend, from family members, from the foods that you eat, from the alcohol that you drink, from the cigarettes that you smoke, right?
Yeah.
From the waters that's being, that's
Oh,
polluted.
I've got water and I've got good water. Well, it's filtered. We've talked about this. So the water that's filtered, they take everything good out of it. So what
Right.
do I do?
When it says it's filtered,
Well,
it's like
Dr.
they
Jenny's
stripped
got
it
an
away
answer
from
for
all the
that.
goodies.
That's right
So,
here. Put the
oh, I love you. Look at
right.
you. Product of the
See,
product,
see how that
Stephen.
works? It's good water now.
I have it. I have my cannabis, I have my coffee, I have my water. Everything's here. I got a pharmacy full of drugs. I'm all
I
set.
got to get more regular with this, I think. You
I
said that
take
it's
that always, religiously before I go to bed. That's the only thing that turns my brain off. But that's if you want to prevent inflammation, you want to prevent cancer, take a dietary CBD supplement. Dietary meaning you're taking it every single day. You don't necessarily have to be struggling with something, like, right? You don't
right.
necessarily, just like drinking water, it's something that you need to do on a daily basis just for better health and wellness. There's lots of things like that you just, it's good for you to do on a normal basis.
Well, and that's why I'm so pleased that you're my doctor because, well, if you didn't know this, Dr. Jenny, was a top naturopath of 2019. She was voted that by the International Association of Top Professionals. Doctors bring her in to explain how to go about a holistic alternative medicine answers and educate them. And so she's a pharmacist. She has an age vital wellness research center as well as a pharmacy right down on Main Street. She compounds all this stuff herself. Dr. Jenny, you are so dynamic. I tell you, it's like, wow.
I'm a drug manufacturer. I'm a drug compounder, right?
But
I
it's
make
good
goodies, but
drugs.
it's custom drugs. You know, the original pharmacy was specialty pharmacies. There was
Yeah.
no such thing as AstraZeneca and Pfizer and Abbott Pharmaceuticals, all these big pharmaceuticals. There was no Merck. There was no mass production of stuff. Each city had its wellness pharmacy, and a doctor would go to somebody's house and they would check little Billy for an earache and a temperature and a cough and, stuffy nose. And the pharmacist would make a formula that was customized for little Billy. Now everything is cookie cutter. Here's a size 1, a size 3, or a size 12. Not everybody fits into these cookie cutter type of medicine. And not to mention that all of the medications that are commercially available are full of carcinogens. So carcinogens that cause cancer. So when you're talking about anti-carcinogenic or a carcinogenic substance, that means that it is causing oxidative stress in your body. It's causing cancer. So you want free and clear. When you're taking medicines, you want to make sure you're taking things that are free and clear of all the carcinogens, because you want to increase compliance and be able to address the symptoms that you have, not just put a Band-Aid over it. You want to be able to get to the root cause of the problem. And that's what I do here at Age Vital Pharmacy. We get to the root cause. We're not just going to, just hand you medications all day long without educating you about lifestyle choices, meditation, prayer, supplements, diet, exercise,
That's
right?
where the
So we're
holistic
focusing on
part
the
of it.
trunk, not just the branches of the tree.
Exactly. And that's the holistic aspect, isn't that correct?
Mhm.
The entire body and from the mind, soul, and spirit aspect of regenerative type medicines that you do or alternative medicine. There's a couple different ways to refer to it. But let's start by explaining to the viewers about gynecologic oncology.
Yeah.
Explain that to us and
Well,
educate
when
us
you go
here.
to women, we have our well visits. Men go to urologist, right? And
Mhm.
then women go to a gynecologist. That's the doctor that takes care of our lady bits to make sure everything is honky dory.
Why is it that they have separate doctors for that? Why do men see one and women see another, huh?
Because one
Good
specializes in
question.
the lady bits and the other one specializes in the mangina, Stephen.
Because they're
Okay.
specialized. That's right.
It's a specialty, right? I mean, you,
Yeah.
you do. The mangina is very special, and the vagina is very special too.
Yes. Yes.
Isn't this great? We get to talk medicine, and it's so professional. We can say vagina and mangina.
Exactly.
Are you
Yes.
blushing, Stephen?
Well, it's real. I mean, yes. Maybe
I see
maybe I'm turning a
Carmen.
little
Hi,
bit red in
Carmen.
the cheeks. I don't know, but it's okay.
Reminds me of kindergarten cop.
Right.
That little
Right.
5-year-old that's like,
Right.
men have, you
Oh,
know.
it's just my modesty. That's all.
No, that's all right. No, but it's important. It's important for women to go and have their well visits. And it's also important for women to be informed. That way the doctors don't scare them into having surgeries that can be avoided. How often I go and, have patients from gynecologists that tell them, okay, you have cancer, you have cysts, you have this breakthrough bleeding. We have to rip out your lady bits. We have to take out your ovaries. We have to take out your uterus. We have to give you a complete and total hysterectomy, right? And then it's like, no, 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 no. Just because it doesn't work doesn't mean to rip it out. Let's figure out why. Why are you having, why are you bleeding for 10 days, 13 days, 15 days, as opposed to a 4 to 6 day cycle? Why do you have, cramping? Why do you have heavy menses? Why? The answer is why. So get to the root cause. So women need to be educated on the endocrine system, because doctors, you do have the, 1 minute, 2-minute office visits at these doctors' offices, and they're just taught to be cookie cutter. You know, when a woman presents with this, give them this. When a woman presents with this, give them that. If it's not working, let's, you know, give them a surgery, a very expensive surgery that insurances will cover, right? But it's unnecessary. I can think of an incident. I was just telling the story to a client of mine. After pregnancy number 2, I got a tumor in my right ovary, and it was the size of a golf ball. It was huge and it was painful. My mom went through the same thing. She ended up having a partial hysterectomy, a very invasive surgery. She was in a lot of pain, right? And I'm thinking, no, I'm not going to do that. So I'm talking to my doctor, Dr. Cohen. He's a really good friend of mine. I'm like, nope, not giving me a hysterectomy, buddy. I said, you know what you're going to do is you're going to test my hormones and you're going to look at my levels, and I'm going to teach you what it is that I do. And so he tested all the markers that I told him to test for: progesterone, testosterone, the estrogen, the thyroid, complete and total hormone panel, pregnenolone, insulin, growth factor. I mean, you name it, DHEA, thyroid stimulating hormone. And then once I got those panels back, I was able to show him, and it's like, well, no wonder I have a tumor. Look at my estrogen. My estrogen is up here and my progesterone is down here. Estrogen is cancer causing, right? So let's get my progesterone past that estrogen. And guess what? That resolves itself. So that tumor that was the size of a golf ball went from a golf ball to non-existent. Now, if I would have listened to him, I would not have baby number 3 and I wouldn't have baby number 4. And I have several women, females, that have the same story where they somehow miraculously just come into my facility. Hi, Carmen. How are you, sexy? Wow. Look at that girl. Boop, boop,
Thanks
boop.
for joining us, Carmen, and everybody. Now, please.
You get a lot of cramping. Yes, Carmen, this is so important because cramping means you have too much estrogen in your body. You have the estriol, the estradiol, and the estrone. The estrone is the fatty-loving estrogen that causes you to start gaining weight. And it doesn't matter how much you work out, doesn't matter how hard you diet, that weight's still going to get on you. And as you get older, your mechanics start to slow down. When you have children, your mechanics start to slow down. One baby pushes you into 25% menopause. After that, it's a 15%. Every single baby after that. So it's like, I've had 4 babies. I should look like an old hag, but I don't.
You look like an old hag.
But you see women. I see women go through it. They lose their hair. They get wrinkly. They gain all this weight. Their boobs start to sag. Their arms start to sag. They have dimply cottage cheese buns. Who wants that?
Because of a lack of estrogen, right?
Because of a lack of hormone support, right? The estrogen causes the weight gain. It blocks leptin receptors. So leptin is what controls satiation in our body. So even hunger is being controlled by estrogen dominance. And then you have the cancer. You can get the breast cancer. You can get the uterine cancer. You can get the ovarian cancer. You can get the cervical cancer. I was going to say
that can lead to cancer if you're not monitoring it. Now, so how often should someone have tests? Because that's the only way you do this is through a test. Isn't that correct?
I recommend checking your hormones every single year. If you have a thyroid disorder, I recommend checking the thyroid every 3 months because it's not something you should be on permanently. The goal when you're doing hormone therapy is to get the body back in homeostasis. So homeostasis meaning the perfect balance, okay? Again, the analogy of a car, maintenance, okay? That's the difference between a classic automobile and a pile of rust. I don't want to be a pile of rust. I want to be a classic automobile. I'm maintaining this mechanic very, very well because I love to feel good. I like to look good. And my children, my mom, my dad, my staff, you, Stephen, if I was falling apart, we wouldn't be here. You're like, oh my gosh, yes. Who wants that? It's like, oh my gosh, what a drag. Who wants to be a drag? No, it's good to feel good.
Right.
Right? Being healthy is sexy.
That's the whole idea.
Right. Healthcare should be sexy. Right now, healthcare is not sexy. Oh my gosh, you're taking these medications. When you go to a normal mainstream allopathic OBGYN is taught to prescribe the synthetic hormones. Okay, when they test their thyroid, they look at all the right biomarkers, the right endocrine markers, but then when they actually put female on the medication, a female presents with hypothyroidism, right? The thyroid gland is slowing down. It's not producing enough of this T3 or not enough of the T4, the liathymine and the levothyroxine. So what does a doctor do? They give them Armour thyroid. They give them Synthroid. They give them Cytomel. They give them Nature Thyroid. None of these thyroids are bioidentical to the body. Armour thyroid is the most popular thyroid medication that women are taking. You look at the black box warning, it's like, oh my gosh, I'm going to get cancer just by this list of stuff. It's a carcinogenic. It belongs to a pig. Women, why are you allowing your doctor to prescribe pig thyroid? Are you Porky Pig? What's the pig? What's the Sesame Street pig? Miss Piggy. You're not Miss Piggy. So stop taking Miss Piggy's medication. Let Miss Piggy take her medication. You're a human being. Take human hormones. It's a simple concept. They do the same thing with men.
That's why you do the natural things. There's no chemicals. There's no using other animals as an answer for our health issues, right?
Right, and not just natural, Stephen. So we have to define terms in medicine, because natural can still mean synthetic. Right. And you see a lot of things that say natural, but is it natural to the body? This is where the term bioidentical comes in, or bio-natural. So bioidentical to me, to my physiology, to the human species. Okay, because formaldehyde is natural. Poison ivy is natural, but you're not going to take that, right? Formaldehyde is an excipient, a preservative, a carcinogen that they put in food. You could go to Whole Foods and still find organic, natural supplements.
Right.
Think about that for a second. You're going to a health food store that still has synthetic chemicals in their foods. It's false advertising, or it's ignorance.
Would they have possibly this GMO type of foods as well?
They still have GMOs. I've done several live streams with grapes, trying to educate the consumer about, okay, guys, what's wrong with this picture? Seedless grape means GMO, because God didn't create seedless grapes. Man created seedless grapes.
Can't have new grapes if they don't have any seeds.
Ta-da! Stephen, I love you.
Well, yeah.
It's the gold star today at Dr. Jenny University.
Because it doesn't have seeds, and the seedless watermelon that's pretty popular these days and stuff like that. But that's genetically modified. Clearly, let's just
wait. Seedless watermelon, seedless oranges, seedless apples, seedless. It was like, it tastes good, but it tastes like really weird, like synthetic to me. Seedless strawberries. They've pretty much successfully GMO'd our produce, everything.
GMOs, and yet we're talking too and about the seeds, and that kind of relates to what we're talking about here, because we're talking about the reproductive system of women. And like I just have to say quickly, the bottom line is that yes, my second wife, I've been married twice, I have, but the bottom line is that God bless her soul, she's not with us anymore. She died of cancer. But she ended up having to have a hysterectomy because she had so much bad stuff going on inside her. They took it out. Well, that throws a woman for a major loop now, doesn't it?
Yeah. Yep. And look at that. And then you're stripping away what makes us female.
Yeah.
Right. And so what do you think is going to happen if you take away our mechanics that provide hormone support? Completely takes it away. We start to shrivel up like a grape. So our ovaries are like our testicles, but they're snug inside our bodies, right? Mm-hmm. Guys have ovaries, but they descended and they became testicles, right? Gonads.
I just learned something.
Right? Well, you were a female before you were a boy. For the first 3 months, for the first 11 weeks of the gestation period, you were a girl before your body decides to.
That's why the woman is supposed to be the leader there in the
The
family.
matriarch, right?
Spiritually
Hey,
speaking, there's
it's like that in nature. Why not? Men would do well if they listened to their females, respected their females, listened to them.
well,
Because
happy wife,
I believe a
happy life.
female is a male's helper, right? The Bible even talks about that. It says, I made female to be your helper, not his slave, not like, oh, God gave me woman. I have something to have sex with,
You're
something
making
to
me
pass around.
you're making me think of the caveman thing where they're dragging a woman behind them or something. It's like, oh my goodness, right?
No,
Well, we're
a
not cavemen
team.
people,
We
so we
are
don't need to act like them
the
anyway, right?
yin and the yang, like this.
Yeah.
The beautiful part, the emotionally strong part of the male,
Well,
right?
yeah, because that's going back to where we started with is that stress can bring on cancer.
Yep.
So we got to reduce stress. So if we
So
take care of our wife or our partner, we won't create as much stress. And I know that there's a lot of stress going on with people these days. I know that there is. And we're going to be dealing with that, as a matter of fact. I'm just going to take this opportunity right now. I think I even have a banner I can put up here for us, because come Sunday, we have a really big show coming up. It's a 2-hour special, Sunday at 3 o'clock Eastern Standard Time. We want you to join us because we're having roundtable. I've got a panel of doctors, energy healers, and as well as a dear friend of mine, Christopher Kaysen. He has been diagnosed with autism. He's going to be with us as well, but we're going to be coping with the pandemic and having solutions for our mental health. And there's a lot of people that are struggling now. And mental health is super, super important. And so I put together this 2-hour special that's going to be streaming to Facebook as well as the E360 TV platform. Download that if you don't have it for your smart TV, for Roku or Amazon Fire, Apple or Android. You can go to our website. You can go up to YouTube. We want you to watch. I'm going to look right now. Here we go. Here is the banner. You may have seen that, folks. That's what I've got out there. Maybe I did this wrong. Maybe I can do that.
No, it's great. So remember, mental health, September 13th. That's this Sunday at 3 p.m., 2-hour special. You're going to get free information on solutions for anxiety, for stress, for postpartum depression, for shame, for paranoia, for migraines, for MS. Okay. Mental health just doesn't mean psychosis. Everything starts neurologically. It all starts in the mainframe. This is our mainframe, and it's so important to take care of our psyche. This is where we tap into the Almighty, the spiritual realm. So if we're stressed out, how can we worship? How can we be, better children of God? How can we be lights to other people if we're falling apart? Beautiful. How can we make a difference in someone's life if we have Alzheimer's and dementia? We end up in a nursing home. We shouldn't have nursing homes. There shouldn't be Alzheimer's. There shouldn't be dementia. That shouldn't even exist. It is a chemical warfare that we have going on right now. It's chemical enslavement.
And we are, if you have to use it, I don't know why everything's looked at like a war, but it seems that everything is considered a war. It's a war on whatever you name this topic to be. Mm-hmm. But we together really are at war. Because we want to educate, and it's a battle to educate people that there's alternatives, and that and Dr. Jenny has the answers, and she makes the products that can help you get healthy. That's the whole point here, and that we can do things to prevent cancer, prevent or reduce the stress. Now is the time to get creative. Now is the opportunity to make a new person out of yourself. That's what I'm doing. I know that we're talking about cervical cancer, but we're also talking about getting healthy. We talked last week, Dr. Jenny, you challenged me about losing weight.
Yes, I did. And we're getting ready. We're getting ready to do that challenge, aren't we?
We are getting ready to do that challenge. It's going to be...
Everyone's going to watch Stephen turn into Muscle Man. Okay, so we have a live question, Stephen, if you want to put it
Okay,
up.
yes.
There
Thanks for
is a
putting that
Melissa
up tonight.
Artman, and she is actually a minister. Love this chica. Talk about a queen bee.
Are we
Very,
talking
very,
about Melissa?
yep, Melissa Artman. If we could put her question
Put
up.
that up there. Thanks for joining us, Melissa, this evening.
And thank you for the engagement, Melissa. So, hi, she says, clarify, just to clarify, can thyroid patients possibly get off armor thyroid, the levothyroxine, or nature thyroid, which was recently recalled? I wonder why. Side effects include blood clots, aneurysms, or cancer. Yes, 100%. So, how we go about this at Age Vital, if you have your thyroid labs, you can go ahead and email them to us or give us a call. If you're watching this, we'll give you a 15-minute free consultation. Might be with me or might be with one of my other providers, a pharmacist, an RN, a nurse practitioner, a pharmacy tech, an LPN, a nurse. One of our age management consultants will help guide you on how do we convert that into the physiologic thyroid form. And we work directly with your doctor. So if you're in a different state, it's going to be the same process. We're licensed in all 50 states and we contact your doctor. We start advocating for you. We become your advocate and telling and educating your doctor as to why you want to get off of that armor thyroid or the cytomel or the synthroid or the nature thyroid. So super simple. You can go to agevital.com. We have a telemedicine consultation form there once you fill that out, or you can just call us at 941-388-0800 or send me a direct email. If you email me directly, my email is Jenny, like Jenny from the block, at agevital.com. So agevital.com, because we want to help you and I want to help women out there. And it's cheaper to be on the bio natural thyroid, the physiologic thyroid. And we dose exactly the same.
I just put it up for you folks. You can contact Jenny through and someone else put it in there. She's got email Jenny at agevital.com. I'm not running a ticker. I normally run a ticker. I've got some technical issues with that. That's why I'm not doing it, because it will cause issues and it'll make the video lag. We don't want that. I'm trying to do as good a job here as I can. But
You're
we
doing
want you to
great.
reach out. And she just told you, you get 15 minutes free. Make sure you mention this show. That's going to be the key. Mention the show. I saw this on Ask Dr. Jenny. We're here to help you folks. That's the whole thing. We want to get you healthy. We want to get you to a point where you can enjoy a quality of life no matter what your circumstances are. That's why I do this show. That's why Dr. Jenny does this show. That's why
Absolutely.
together we do the LWN Live with Nature Foundation, because we're out there as a resource to help people become the best person they can possibly be. And we're committed to
Absolutely.
it. And I
Prevention
tell you
is
what,
key.
we can use your support, folks, too. We need your support. We're about to
Well,
open a referral center here in very soon, very soon. As a matter of fact, tomorrow we're getting together on that. Yes, Dr. Jenny and I and Cheryl Evans. I will announce Cheryl Evans. She is our case manager, and she's going to be helping you to be able to get to the answers that you might need, whether it's to get recovery for drug addiction. We're opening right here. It's going to be at Age Vital, right downtown
mm-hmm.
Sarasota. If you're addicted to drugs or alcohol or anything like that, we're going to help you there. We're going to help you get to the people that can help you and get you some recovery. If you're homeless, we're going to help you get the things that you need, whether it's food, clothes, housing. We're going to have for you. If it's mental health issues, we have a network of professionals. And Dr. Jenny has the product to be able to help you be able to overcome that. We'll be talking more about that Sunday at 3 p.m. on
Detoxing.
uh,
Truly
yep,
detoxing,
welcome
not
to
just getting
pandemic.
you hooked on another drug. Because these are the issues. You go to these rehab centers
Yeah.
and someone's addicted to a street drug, but then they get addicted to a pharmaceutical drug. It, still the same, guys. We
Well,
want you to have a drug-free lifestyle, to be able to get back on your feet again. And it's so wonderful to see people get back on their feet again, because you can't judge somebody when they initially go to a mainstream doctor who's the first person that wrote them that gateway drug to begin with, right? Because usually that's what it is. They have a surgical procedure, they get an opiate written, they get addicted to that opiate. It starts already blocking dopamine, all the serotonin. They start not sleeping, they get constipation, then they refill it, and then they get another psych medication to help with the anxiety that comes with it and the lack of sleep. And you see how that progresses so fast. And then the doctor's like, oh my gosh, we're writing too much of this, right? They cut them off. And then they end up going on the street, right?
Yes,
so
exactly. I know.
We as a community need to take responsibility, and we need to teach other people to take responsibility. Don't judge somebody that's homeless,
Right.
because you don't know why they were there and why they got there to begin with.
It could be anybody.
It could be anybody.
Or somebody, and particularly now, and that's what's important to us as well, is what's happening is mental health admissions are skyrocketing. Suicides are skyrocketing. We're going to be dealing with that as well. We're going to be talking about these types of things on Sunday at 3. But tonight we're talking about cancer. We're talking about cervical cancer in particular. We're talking about the fact that there's 1 million people in the last 10 years that have been diagnosed with cancer, and how you can get healthy with not just natural, okay, because we talked about that. It's not just natural. It's got no chemicals in it.
Right.
It's got no GMOs in the product.
Mm-hmm.
It's the real
It's
stuff.
the same thing. When a female goes through menopause,
Yeah.
what's the number one prescribed medication that an OBGYN would give to a woman?
Estrogen.
They give them Premarin. Estrogen.
Okay, see, like I know that.
Right. And Premarin, wait for this. This is how gross it is belongs to a pregnant mare. It's from the urine. So you're taking horse estrogen. Yay! And you look at the black box warning there: blood clots, aneurysms, heart attacks, stroke. Make sure not to smoke while you're on this, because it just increases the side effects that we naturally put in there, because we're giving you, horse estrogen, pig thyroid. What's next?
Since we're going to go there, I'll go there. I don't have a problem saying this. The fact of the matter is that, the pharmaceutical companies don't want you to get healthy. That's plain and simple. They don't, they don't continue to do business when you're healthy. We're going to try and teach you how to be healthy without having to get addicted on other drugs, and put yourself in a position that, from a mind, body, and soul, spirit standpoint, because there's a lot involved here, folks. It's not just getting some exercise and eating well. We talked earlier, you said that with respect to the cancer screening, it should be twice a year, right? What do you do?
Oh, you should get screened every single year. But I recommend even, looking at an antioxidant panel, doing a nutritional analysis. Okay, this is what's called functional medicine. You're looking at exactly what the body is deficient in. You're looking at mold markers, you're looking at fungus markers, parasite markers, you're looking at antioxidant status. So when your antioxidants are low, it means that your cells are oxidizing faster, right? They're dying off, because each cell has a life. Red blood cells are supposed to live for 120 days. And then within that 120 days, if you have carcinogens that are in there attacking them, they start to mutate, and then it re-expresses your genetics in a completely different way. So you have to go ahead and look at those types of markers. So antioxidants, hormones, endocrine, fatty acids, vitamins, minerals, enzymes, insulin plays a huge part. And then look at what is your life, doing. Are you a tobacco? Are you a user? Are you an alcohol user? Are you an abuser of different medications, right? And did you just have a baby? Females, right? Doctors don't prepare women for how depleted you will be when you deliver a child. Okay, that child is like a cancer growing inside of you. It acts the same. It takes all your nutritional source, right? It's taking all of your nutrients. And if you're not taking it in, if you're not replacing those nutrients, then the baby's going to take it from your bones. So once you deliver that baby, all of a sudden you have this cute, delicious little baby. So cute. But mama's like, oh, hair's falling out, wrinkly, depressed. The baby blues. It's not baby blues. It's called someone pump me full of hormones, please, because that baby looks the way it does because it ate me. It literally took everything from me. So you have to regenerate. So think of yourself like a flower, like a garden. You have to constantly fertilize the garden. What does a flower need to grow? Fertilization, sunlight, water. So we are walking plants, folks. You're only going to be as healthy as how you take care of your garden. So feed your body, not the cancer. Feed your body life. Feed your body vitamin D, vitamin E, vitamin A, CoQ10, vitamin C, zinc. I just listed off antioxidants, 6 of them. CBD, it should be labeled as an antioxidant. And then balance out your hormones. Which hormones progress cancers faster, right? Estrogen is a killer for both men and for women. There's a 13% increase in breast cancer in men. 13% of the cases are guys. Guys shouldn't even be getting breast cancer because their estrogen is so low, right? So progesterone, get on a progesterone. They have some progesterone creams over the counter. Teenage girls that have really heavy menses, progesterone balances that out. A supplement called Aromadim blocks estrogen. Get on natural estrogen blockers. Zinc is great for both men and women, and zinc is a poor man's Viagra. So you want something that works like Viagra, get on some zinc. I lost you. Can you hear me? Yes or no? I can't hear you. I think you turned me off.
Oh, nobody can hear me because I had my mic muted.
Could they hear me?
Talk it away.
There you are. I was like, Stephen, I can't hear you.
This is what I get. Where are you, Christopher? We needed you tonight. Dang it. All right. So, gosh, what did I was saying? Tell us about the Aromadim. Let's just back up. I was talking Aromadim and how that's effective, and I said that you had prescribed that for me, or yeah. And
yeah, it's an over-the-counter supplement.
It's over the
There's
counter.
no prescription, right?
I mean, you suggested it. Let me just take that back. So Aromadim. How does that play a role?
Well, Aromadim is a natural estrogen blocker. They call it an aromatase inhibitor, but this is an amino acid that blocks the overabundance of estrogen that your body's not using. So it usually you could even combine it. It's in the same chemical pathways with vitamin D3, with vitamin E, with calcium, the indole 3 carbinol. It is like a whole entire compound of natural estrogen blockers, but the DIM complex is the main chemical in there that helps to get rid of too much estrogen in your body.
Okay.
And you'll even lose weight. Like if you have some fatty areas on your body that are from estrogen dominance, that DIM complex will help you. People will usually lose about 10 pounds within a week of taking that. My women love it. My guys do too. If you have the gynecomastia, bodybuilders especially, right? Because
Right.
when you're
Sure.
working out, you're producing a lot of testosterone. That testosterone converts into estrogen, and then they're getting the nipple sensitivity. It's like they're going through PMS, itchy nipples, nipple sensitivity, painful breasts, right? Women don't like that. We don't like when our men are acting too feminine, right? There's only room for one
You heard that.
emotional.
You heard that, gentlemen. Let's not act too like women. We need to act like men. Now, we can be nice. It's like, oh, sometimes we need a little bit of love, though, Dr. Jenny.
Just a little bit of love.
Well, you said it when we first start. We're, we're a girl, right? No matter whether we're a guy or not. I mean, come on. We, have we gonna start something now? I tell you. No, I know that there were some questions here, and so I want to get back to that. I was too wrapped up with talking and not having a mic, wondering where's my helper. Darn it. Okay, I love him. He'll be back soon. That's what we want. We want you back, Christopher. All right, so things don't happen like that. Okay, so yes, Dr. Jenny, are there certain common medications to avoid?
Medications that
To avoid. Let's put that in the text. The context of, is there certain medications that people should be avoiding, women in particular, to avoid cancer?
prescription medications. Remember, there's lots of carcinogens in these big pharmaceutical drugs.
Yes.
Where do we start? Anything that takes away, that strips away cellular function, or I should say neurological function, right? So brain cells, red blood cells, white blood cells, anything that does that. Those are the types of medications. I know that the FDA is really, trying to take away like the ones that they show absolutely irrefutable attitude, like Zantac. The FDA ordered Zantac being taken off the market, and that was last year, because of the carcinogen that's in there as an excipient, as a filler. And how many people were taking Zantac? Everybody was taking this medication.
That's what was supposed to work for the indigestion, right?
Right.
Or
Yep.
Prilosec
Zantac
or
and
whatever.
yeah,
Yeah.
and so and we shouldn't be, going through trial and error. I mean, the chemical doesn't belong in our body. We shouldn't be selling it. If I can't test for it, at least that's my methodology. If I can't test for it and it's not naturally in your body, don't put it in there. Like high fructose corn syrup. Avoid high fructose corn syrup. That's a GMO version of fructose, right? Aspartame,
yes.
another GMO sugar.
Yes, and I know that we've talked about that before. Dr. Jenny, I want to ask you, what would be some of the symptoms if some of our viewers are out there and they are maybe experiencing some symptoms? What would these symptoms be that would say and go flashing red light? Hello, do something about this. What kind of symptoms, if they're maybe having the cervical cancer, that they should be paying attention to? And in addition to that, I know that Lone, that was my second wife, that she was bleeding profusely. So that was a really major, that was a signal. I just didn't know at the time that was a signal. Can you explain to us what the women should be looking for other than testing on a regular basis? What should they be becoming aware of?
Well, if you have pain in your pelvis, specifically for cervical cancer, if you have, abnormal menstruations, like you said, heavy menstruations, not normal, so irregular menstruations, having spotting and not a full flow, or if you have a cycle 6 days and then 10 days later you have another cycle, right? That's an abnormal menstruation cycle. Abnormal, that's the vaginal discharge. If you have yellow or green, or if there's odor, fatigue, nausea, weight loss that's unexplained. So things like that is what I would, look for. breast cancer, discharge, anything funky coming out of, out of the nipples. And I mean, all cancer, the root cause is all going to be the same, but you have different signs it's signaling. So anything that's not of the normal, you want to go see a doctor, right? Prostate cancer, the same thing. If you're having problems urinating, guys, that's a big sign. You need to go see a urologist. If you have this urge to go pee, but you can't pee. Breast cancer, like I said, lumps in the breasts, bloody discharge coming out of the nipples, a different shape and the texture of the nipple or even the breast. Then you have like the basal cell cancers or the colon cancers. I mean, it all has warning signs. So if it's something that's not normal in your body, you go see a doctor, but then be functional about it too. Don't be so, don't let them scare you into, okay, gotta have chemo, gotta have radiation, because that's not the answer. We're not chemotherapy deficient. We're not mustard gas deficient. That's what Hitler used to do to the Jews. That's the when he would fry them, right, in the chambers. Right. That was chemotherapy. And we have a majority of the population that signs off on, yes, please,
a lot of
kill me slowly.
A lot of people go through chemotherapy, and that's really where we hadn't touched yet is the different types of therapies people might be going through. I think I would like, I'm going to go to a statement here with the LWN for you in just a minute. But we talked earlier about the fact that there are alternatives to the standard modalities like chemotherapy or radiation treatment. And you mentioned that if people suspect that they might have cervical cancer or cancer of any, if you think you are sick seriously sick at all, reach out. You mentioned that you will talk for 15 minutes to somebody. If they mention this show, I want you to address that again.
Yeah, 15-minute free consult. Give us a call. Know what your options are. Go to our website. Schedule a telemedicine consultation. If you're here locally, come on in. So I always love to see you. Regardless, the telemedicine consultations, it's just like this, just like me and Steven talking back and forth. agevital.com. That's right, Melissa. Thank you for that, Melissa Artman. I hope that she's still here. And give us a call at 941-388-0800 because we want to help you be healthy. I had a cancer patient referrals from Moffitt, from the Mayo Clinic, from the Cleveland Clinic. I usually get them when the mainstream therapies didn't work. They did chemo, they did radiation. They send me the referrals and tell me, okay, they have 6 weeks to live. They have a month to live. They have 3 months to live. No pressure. So now I have to work harder, making the body stronger after they fried the mainframe. Can you imagine frying your computer board and then trying to put it back together?
No.
Well, that's what's happening.
But
so when the first line of defense should have been, I mean, you have study after study after study after study from the most prestigious universities, the clinical journals that show vitamin D is anti-carcinogenic, meaning it helps to get rid of the cancer. Vitamin E, vitamin A, vitamin C, glutathione, N-acetylcysteine, L-taurine helps stop the metastases of certain cancers. And that's an amino acid.
Can I just interrupt for a minute? You said taurine, and that triggered me to think about like a lot of these drinks out there today have taurine in them.
Right, but you have to be careful.
Drinks, right? So that's good for you, huh? I was thinking, I didn't know whether that was good or not.
Well, you have to be careful with that because you have synthetic vitamins and minerals and enzymes and amino acids out in the market. This is why it's so important to consult. Don't just go blindly purchase stuff off the shelf, not knowing what those ingredients are. You see A through zinc, like Centrum Silver. 70% of what's in Central Silver is a carcinogen. That's a vitamin that's over the counter. It's all synthetic. It's got cyanide in it. You can look it up, Google it. Centrum Silver. Yeah. You can look at the B12 that's in there. It's a cyanide cobalamin. So it's a cyanide B12. They altered it, they GMO'd it, so they put a little bit, cyanide to help preserve it, right?
Yeah, and you made me think about things that other different types of products and things that we might purchase that might have cancer causing agents in them, and like the dyes in our clothes, even, and things like this might be a situation. I know it's a situation for my day job for real, because other types of applications that people use have cyanicides in them. That's cancer causing stuff.
Hmm.
We need to be careful about a lot of things that we're using and consuming.
Yep,
Important factor.
absolutely. I see a really good question from Yvonne Collins, if you want to
Let's
put
go
that
to
one
the
up.
questions.
Hmm.
Thanks for putting that out for me.
Yep.
Um, yes, here we go. Thank you, Yvonne.
So, my grandmother had breast cancer. What are my chances genetically? Okay, genetics does play a big part, but you can re-express your genetics in the positive way, Yvonne. And you've already taken the steps with all of your weight loss efforts. I mean, you've lost an entire person, I think. I remember the day that I dragged this girl into my facility, and I'm like, that's it. I'm done watching you get heavier and heavier and heavier when I know what a beautiful person you are inside and outside. So I want the outside to match what
Hmm.
I know is here and here. And
Well,
she did. She
having
lost
the
it and she
extra
feels so
weight
much better. So there's
is
how
not so
she's
healthy,
re-expressing, right? She's
right? I mean, that's
re-expressing.
just stressing the heart and everything. And
Yep,
yeah,
stress in your
gosh.
heart, and she's got beautiful children. I recommend people do a PGX testing. So the Human Genome Project is huge. You're able to look at all of these genetic predispositions and look at your genetics and how your body reacts to vitamins, to minerals, to everything, how you're absorbing it. And it'll show you any genetic mutations that are in there. Like, I was shocked when I found out some of the genetic mutations that I personally have. I grew up in a third world country. So, I mean, for the first 7 years of my life, I was malnourished, right?
Mm.
So, my genetics, I do not pull my B12 out of my foods. I have to take an injection, a methylate, right? If my B12 gets too low, my iron gets too low, my folate gets too low, it's all methylation issues. My A1C, my hemoglobin, my hematocrit drop, and I can put myself at risk of having heart palpitations, anxiety, a
Mm.
panic attack, a stroke. And that's scary.
Well, I just got to say, we're so glad that you got into naturopath medicine, and that you're helping people, and that's what you do, is you help people to overcome maybe whatever types of situations environmentally or physically that they've been experiencing to get better. Now, I want to go to this next question too as well, and I want to, and hopefully I'm going to get this right. Oseen, Green,
Osheen.
Osheen. There's an H sound there too. From Scotland,
Yeah, he's Irish. And
Irish.
he is one of the soccer coaches at IMG. I love
Yes.
having, the support of these amazing teachers like Osheen, right? Teaching our youth, teaching
Amazing
our
gentleman. Yes.
future. Yep.
IMG Academy here in Bradenton. Yes.
Yes,
So he has a
absolutely.
question now too. Oshin has a question for you, Dr.
So
Jenny.
it says, Dr. Jenny, what are the best sources of vitamin D and E, like you mentioned? Natural sources like sunlight and juices or supplements? Gracias. De nada, Oshin.
Yes, de nada.
So de nada. You are welcome. So
Yes.
vitamin D, organic whole milk, yogurts, and make sure they're free range or organic. Sunlight definitely plays a big role. I recommend an hour of sunlight a day, not during the hottest time of the day, but in the morning when it's still a little bit crisp and cool, and the grass still has a little bit of that dew from the nighttime, or in the evening at sunset, right? Like an hour and a half to 2 hours before the sun sets. That's a great source. But myself, I love drinking my milk. Milk, the commercials always used to say milk, it does the body good. Now there's like big campaigns that milk is this killer, that milk is bad. And it's like, no, milk that's been, that comes from a cow that's being fed garbage is bad
Okay.
for you, right?
Now,
That's why you want a free range, because milk, I mean, these are like gigantic bees.
I love it,
I
Dr.
call
Jenny, because I love milk. You're
I
making my
love
day
milk
here.
too. My
Well,
gosh. And the
I
Bible
just
says
gotta
the
throw in a
land
quick
of milk and
story.
honey. And it's a superfood. Milk is a superfood, but you have to make
I
sure it's
I
organic. You have to make sure it's that, the right type of protein. And
yeah,
you can get the non-homogenized, the raw milk that you can cook and boil.
unhomogeneous.
Oh, so good, because then you have all that cream that goes to the top. And these are the good fats. Milk actually
Beautiful.
helps you to lose weight, and it helps
We're running
reduce
down on time, but
allergies.
I wanted to say I lived in Washington State for a while, about 10 years or so. I
Mm-hmm.
worked at this dairy farm one time. It was just natural. They didn't shoot the cows with anything or nothing. Having the
Mm-hmm.
milk out of those cows, straight out of the bin without being homogenized, just straight from the cow into the tank, dip my cup in, drank that. Oh my goodness, it was the best in the universe. We got to
Oh,
find a source for this.
so
um,
good.
okay, so we're about out of time. I want to remind everybody to join us Sunday at 3 p.m. Eastern Standard Time for coping with the pandemic, solutions for our mental health, power roundtable. Dr. Jenny, I've got several. Let's see. Let me just go off here. We have Leah Lange as well. We have Christopher Kaysen. He's been diagnosed with autism. We have well, I didn't write it down in front of me, but I tell you what, we've got a post out there. Take a look at that post. Make sure that you share it. Apologize for those of my guests that I'm not getting their name right off the top of my head. Stage fright? No, I'm not having stage fright, but I'm just having a senior moment. Okay, so thank you, everybody. We love you. I'm going to go ahead and let Dr. Jenny wrap the show up here. We want to see you next Wednesday, 7 p.m. Eastern Time. Come back and join us again. Dr. Jenny, take us out.
I hope you guys, I want to bless you guys, the viewers, that you have many, many moments this week until I see you, until Steven sees you next week, next Wednesday. Kindness, love, and may you spread your light to other people. May you be kind and extend kindness always to strangers, right? Bless your strangers, do something nice. And if it's not something that comes naturally to you, fake it till you make it, right?
Exactly. Exactly.
Because laughter is contagious. A smile is contagious. It helps produce that oxytocin, and oxytocin is a love hormone,
I'm
that
gonna
nurturing
create some
hormone.
I'm gonna create some of those good hormones tomorrow morning at about 6:30 a.m. I'm going to the celery fields here in Sarasota. Lions, tigers, and bears. They'll be roaring in the background. Join me tomorrow morning for sunrise and welcome a brand new day. We'll see you then. Thank you, everybody. We love you. Have an exceptional week, and we'll be back soon. Bye for
Thank
now.
you. Bye.